Have you ever wondered what happens when your body rejects the blood that was meant to save your life? Imagine this. You're in the middle of a night call, and suddenly, a patient undergoing a blood transfusion starts showing signs of distress. This, dear listeners, is the fascinating yet complex world of transfusion reactions. Transfusion reactions, while relatively rare, can occur when the body's immune system reacts negatively to a blood transfusion. It's a high-stakes, high-pressure situation that demands swift action and a deep understanding of the human body's intricate responses. This isn't just a topic for medics and scientists, it's a glimpse into the marvels and mysteries of our bodies. It's about the careful balance between life-saving interventions and the body's instinctive defenses. It's about the challenges that medical professionals face when the unexpected happens, and the strategies they employ to overcome these hurdles. So, are you ready to explore this captivating subject? Join us as we delve into the mysteries of transfusion reactions. Imagine you're a doctor on a graveyard shift and you have a patient who has just received a blood transfusion. Picture this. It's the middle of the night, the hospital corridors are quiet, and you're on duty. The stillness of the night is broken by the sound of a nurse's hurried footsteps. She brings news of a patient, let's call him John Doe, who has just undergone a blood transfusion. John, a middle-aged man with a history of anemia, was admitted earlier in the day for a scheduled transfusion. Everything seemed pretty routine until about 15 minutes into the procedure. John began to show signs of discomfort, which quickly escalated to distress. He complained of a sudden onset of chills and a pounding headache. His skin, once pale from anemia, is now flushed and he's breathing rapidly. You rush to John's side. His vital signs are concerning. His heart rate is higher than normal, and so is his blood pressure. You also notice a slight increase in his body temperature. You're puzzled. These are not typical post-transfusion symptoms, and they certainly aren't symptoms of anemia. You start to question everything. Was there a mistake during the transfusion? Did John receive the wrong type of blood? Or could this be a reaction to the transfusion itself? You recall your medical training, running through all the potential complications and adverse reactions that can occur during and after a blood transfusion. But without further tests and examinations, you can't pinpoint the cause. You're in a race against time. John's condition is deteriorating, his symptoms are intensifying, and he's becoming increasingly restless. The quiet night has turned into a night of uncertainty and urgency. You need to figure out what's happening, and fast. The clock is ticking, and it's up to you to figure out what's happening. Let's take a step back and understand what a transfusion reaction is. A transfusion reaction is a medical phrase that describes an adverse event following the infusion of blood or blood components into a patient. This is not as simple as it sounds, as the human body is an intricate system where everything is interconnected. Transfusion reactions occur when this complex system tries to reject the foreign blood components, leading to a range of symptoms and complications. But what causes a transfusion reaction? The most common cause is a mismatch between the donor's and the recipient's blood. Just like a lock and key, blood types need to match for a successful transfusion. If they don't, the body's immune system will wage a war against the foreign blood cells, resulting in a transfusion reaction. However, blood type is not the only factor. Other elements in the blood, such as antibodies and white blood cells, can also trigger a reaction. Even factors like the temperature at which the blood was stored can play a role. This shows how delicate and precise the process of blood transfusion really is. Now let's delve a bit deeper and look at the different types of transfusion reactions. They are broadly categorized into two types: acute and delayed. Acute transfusion reactions occur within hours of the transfusion. They range from mild to severe and include allergic reactions, febrile non-hemolytic reactions, and hemolytic reactions. Allergic reactions can cause hives and itching, while febrile non-hemolytic reactions can cause fever and chills. Hemolytic reactions are the most severe and can lead to kidney failure and shock. Delayed transfusion reactions, on the other hand, occur days or even weeks after the transfusion. They are often less severe but can still cause problems like jaundice and anemia. At the heart of these reactions are the physiological and immunological processes. When the body senses foreign blood, it triggers an immune response. Antibodies bind to the foreign blood cells, marking them for destruction. This process can cause inflammation and damage to the body's own tissues, but it's not all doom and gloom. The human body is remarkably adaptable and can often handle these reactions with the right support. This is where medical intervention comes in, with treatments ranging from medication to manage symptoms to more complex procedures like dialysis in severe cases. It's also worth noting that not all transfusion reactions are negative. Some can actually be beneficial, like inducing immunity or helping to fight infection. So, transfusion reactions are a complex interplay of factors, from the type of blood transfused to the body's immune response to the medical intervention provided. They are a testament to the intricate and delicate balance of the human body. Now that we understand what a transfusion reaction is, let's go back to our case study. Our patient is getting worse. What could be triggering these symptoms? Let's take a closer look. Now we know that our patient has been experiencing a high fever, chills, and a sudden drop in blood pressure following a blood transfusion. These symptoms are severe and quite concerning. They could indicate several possible conditions, but what's most likely given the context? One potential cause could be a bacterial infection. It's possible that the blood used in the transfusion was contaminated, leading to sepsis. This would certainly account for the fever and chills. However, this doesn't typically result in a sudden drop in blood pressure. Another possibility is that the patient is experiencing an allergic reaction to the transfused blood. Allergic reactions can indeed cause fever and chills as well as a drop in blood pressure. But again, this doesn't quite fit. Allergic reactions to blood transfusions are typically immediate, and our patient's symptoms didn't start until several hours after the transfusion. So, what's the most likely culprit? Given the symptoms and their timing, it appears that our patient is experiencing a transfusion reaction, more specifically, a hemolytic transfusion reaction. This occurs when the patient's immune system attacks the transfused blood cells, causing them to burst or hemolyze. This reaction can cause fever and chills, as well as a drop in blood pressure. But how can we be sure? Well, the patient's lab results provide key evidence. The presence of free hemoglobin in the patient's blood and urine indicates that red blood cells have been bursting. This is a hallmark sign of a hemolytic transfusion reaction. Additionally, the patient's blood type was rechecked, and an error was discovered. The patient, who has type A blood, was mistakenly given type B blood. This mismatch would certainly trigger an immune response, leading to the destruction of the transfused blood cells and the symptoms we've observed. It's also worth noting that hemolytic transfusion reactions are often severe and can be life-threatening, which aligns with the seriousness of our patient's symptoms. So, through a careful examination of the patient's symptoms, lab results, and medical history, we've been able to identify the cause of our patient's distress. It's a hemolytic transfusion reaction triggered by a mismatched blood transfusion. But our work isn't done yet. Uncovering the cause is just the first step in resolving this medical mystery. Once we've identified the problem, we need to take action to treat the patient and prevent further complications. So we've identified the cause of our patient's distress, but what now? The next step is to manage and prevent further transfusion reactions, which we'll delve into in the next segment. Knowing the cause is one thing, but managing the situation is another. A transfusion reaction can be a daunting event, but with the right tools and knowledge, it can be managed effectively, and even more importantly, it can be prevented. So how do we manage a transfusion reaction? The first step is to stop the transfusion immediately. This is crucial. Stopping the transfusion at the first sign of a reaction can limit the severity and help prevent further complications. Next, we maintain the patient's vital signs. This might mean providing oxygen, administering fluids, or even giving medications to address symptoms like fever or allergic reactions. It's all about stabilizing the patient and ensuring they're as comfortable as possible. And then, it's time to investigate. We need to confirm that a transfusion reaction is indeed what's happening. This involves rechecking the patient's blood type, examining the blood product, and conducting tests to identify the specific type of reaction. All this information is crucial for the next step, which is treating the specific reaction. Treatment will depend on the type of reaction. For example, if it's an allergic reaction, antihistamines might be administered. If it's a hemolytic reaction, the patient might need diuretics or kidney support. Each reaction requires a unique approach. But what about prevention? How do we stop these reactions from happening in the first place? Well, prevention is largely about careful screening and testing, both of the donor and the recipient. This includes rigorous blood typing and cross-matching, as well as screening for antibodies that might cause a reaction. Communication is also key. The medical team needs to be well informed about the patient's history, including any previous transfusion reactions. The patient, too, should be educated about the signs of a reaction, so they can alert the medical team if something feels off. Lastly, but not least, we need to remember that not all transfusion reactions can be prevented. Sometimes, despite our best efforts, reactions still occur. It's not a failure, but a reality of medicine. And when it does happen, it's our responsibility to manage it quickly and effectively, always with the patient's well-being as the top priority. Remember, knowledge is power. The more we know about transfusion reactions, the better we can manage and prevent them. It's not just about understanding the science, but also about being vigilant, being prepared, and being ready to act swiftly when needed. With the right knowledge and quick thinking, we can manage these reactions and potentially save lives. The field of medicine is one of constant learning and adaptation, and transfusion reactions are no exception. By staying informed and proactive, we can make a real difference in patient care. The night may be dark and full of terrors, but with the right knowledge, it's also full of potential for healing and hope. So, what have we learned today? In the course of our discussion, we've explored the complex world of transfusion reactions. These reactions, as we've come to understand, are not merely adverse side effects, but rather serious medical conditions that can occur when the recipient's immune system reacts against the transfused blood. This could be due to anything from an allergic reaction to an outright immune response against the donor's blood cells. We've delved into the intricacies of identifying these reactions, understanding that early recognition is integral to effective management. We've seen that symptoms can range from fever and chills to more severe manifestations like shortness of breath or chest pain. We've also learned that the timing of these symptoms can provide valuable clues, with immediate reactions often being more severe than those that occur hours or days after the transfusion. The case study presented shed light on the practical application of this knowledge, reinforcing the importance of vigilance and quick action in a real-life setting. It demonstrated how a keen eye for signs, coupled with a swift response, can make all the difference when dealing with a potential transfusion reaction. Our exploration of management and prevention strategies emphasized the importance of thorough pre-transfusion testing and patient monitoring. We've understood that cross-matching, blood typing, and antibody screening are crucial steps in ensuring the safety of blood transfusions. Moreover, we've seen how careful observation during and after the procedure can help catch any reactions early, allowing for prompt treatment. But perhaps the most important takeaway from our discussion is the central role of knowledge and preparation. With a solid understanding of transfusion reactions, their signs, and their management, healthcare professionals can ensure a safer environment for patients undergoing blood transfusions. As we wrap up our discussion, let's not forget that the study and understanding of transfusion reactions is an ongoing process. Medical science is constantly evolving, and with it our knowledge and strategies for dealing with these reactions. Remember, in the face of a transfusion reaction, knowledge is your most powerful tool.